Hello, everyone. Welcome to the Massachusetts Child and Youth Serving Program's Reopen Approach. This is an overview of the reopening process for providers, for group and school age providers. And we're excited to share with you some steps for reopening. So let's look at the agenda. First of all, we want to share a little bit about the minimum requirements for health and safety. Then we will talk through how to prepare for reopening, some changes you can expect for the workforce, and supports and resources that are available as you get started. As you all know, on June 1st, the Department of Early Education and Care released the minimum requirements for health and safety, and this was initial guidance for reopening safely during this time of COVID-19. We released these on June 1st because we know that we wanted to provide a lot of lead time for programs to begin to think through what changes might be required to their operations and their physical spaces before they would reopen. On June 6th, Governor Baker announced that we would move to phase 2 of reopening for the Commonwealth. This then began on June 8th. This meant that providers could begin entering their spaces again and actively preparing to reopen. Last week, we released our reopening plan template and sample attestation form. We also revised our minimum requirements and began the active work of supporting programs in reopening. Now, we are excited that programs can begin to submit their application to reopen. This is done by submitting the reopening plans in our LEAD system through the reopening transaction. Programs will then begin reopening as early as the week of June 22nd. Our goals for today are to understand the minimum requirements and where there is flexibility for programs to design the solutions that make the most sense for them, to think through the reopening process and be prepared to activate that transaction in LEAD, to think through the plans and how they'll use them to develop either their own plans or to use the EEC template to submit their application to reopen, to understand how those plans will be reviewed and where the department is there to help and support them, to understand what is happening with background record checks and teacher qualifications in the workforce and how that will impact reopening for your program, and then what resources are available throughout the reopening process and beyond. So starting with the minimum requirements, we have continued to iterate upon these as we have gone, often based on all of the feedback that has come from the field and questions. And our most recent draft, as you may have seen, was released on June 12th. The minimum requirements are meant to guide reopening in phase 2. They are intended to apply through July and August, and of course will be evaluated in a more comprehensive way as public schools start to reopen and we move towards a different scenario in the fall. But for July and August, the minimum requirements are really designed to minimize the spread of COVID-19 in this new operating environment that we have come to know. Ultimately, the requirements come down to a couple of key principles that are listed here below. The first of these is, it comes down to what we call stable groups, and that is about minimizing the number of individuals any potentially exposed person comes into contact with. So this is about limiting contact between groups, so no person actually moving in between classrooms or commingling different groups together. It's also about minimizing prolonged close contacts, even inside a group, to every degree possible. We want to share a little bit about working with the minimum requirements so you can understand some of the areas where, or examples where we think there may be flexibility required. We recognize that not everything is feasible in the childcare space and that there are child development needs, as well as things that are required just based on the spaces that you're in and the operations that you're considering. One of these is physical distance. We know based on how children work that physical distance is not always possible. And so we encourage you to be thinking about things like how your program activities are designed. Instead of a close circle for circle time, could you put the dots or the hula hoops in specific places that are at a physical distance from each other? Could you put learning or activity stations at a distance so that children are encouraged naturally through the day to be at a physical distance? When it comes to transitions, moving indoors and outdoors throughout the day, could you manage the timing of those across the operations for your center in a way so that children are not mixing in the hallways, and so that they're physically distanced in their lineup, and maintaining that distance as they go indoors or out? All of these are the kinds of things that we're hoping that you can accomplish through planning and through design, rather than through your interactions with the children themselves, because it is not our intention that you have to be constantly scolding or telling children to be distant. We do not want this to be a punitive thing or to become about the relationship between the child and the teacher. This is instead something that we want to be encouraged, but that we know children will move around the classroom, they will come into contact with each other, and it is not something that is possible to control at all times. So we wanted to be realistic about that. We also know that some children will not want to wear masks or maybe scared by them, and that is okay. We do not want to force children to wear masks. As programs, it is up to you to communicate with the families to decide an approach that makes sense for each family and for the program as a whole. One thing I do want to say about this, however, is that we have heard from many, many teachers and educators whose top concern is the health of themselves and their families. And we do want to protect this workforce as they come back to work in the COVID-19 operating environment. And so please, even as you have the conversations with families about what is comfortable for them, also prioritize what is comfortable for your workforce. What are the risks among themselves and their family members, and make sure that the practices that you're adopting for your classrooms and for your centers are flexible both for your educators and for the children that they're working with. Also, we want to say childhood, summer, playing outside, being in the sprinklers, giggling, all of this is meant to be fun, and we want children to have a childhood. For goodness sake, they have been under a stay-at-home order. They have been out of school or out of childcare settings now for a couple of months. We want them to be with their friends and run and play outside. Please, all of these things are okay. We do not want we don't want early education and care to feel punitive. We want it to feel fun. Just do it as safely as possible. Finally, I know that the group size limitations for preschool and school-age children are a challenge for the operating budgets and approaches for many centers. We will continue to support programs as best we can with any means possible, and are working to find solutions for this with hopes that we can continue to address this as we go forward, and to revisit the ratios and the group sizes as we move into the fall and as the public health situation improves. Some of the changes to childcare, just to give an overview, these 6 key areas. So as you all know, we are altering some group sizes. This is for preschool and school age primarily. We are recommending daily screening on drop-off. This is a verbal screening with families and a visual screening of children. We are asking that programs prepare for potential illness with a plan for isolation of sick children and communication system with families. That they intensify hygiene practices for children and for staff, increase cleaning and sanitizing and disinfection practices, and store those safely away from children, and then remove materials from the classroom that are high risk. These may be sensory tables where there are children in close proximity to each other and sharing materials, or they may be soft materials that need to be washed too frequently. I also just want to note, I think there may have been some misconception broadly about what is required versus what is encouraged. In the requirements, we actually use the term encouraged when we speak about physical distancing and when we speak about masks. And so just to reiterate, this is a decision. The mask wearing is a decision between programs and providers and families. And so we hope that that is something that you'll be in communication with your families about, and a decision that you will make together. And physical distancing is something that is encouraged, but we know that it's not always feasible to maintain all the time. And so we encourage programs to incorporate physical distancing into their program design, into their activities and their transitions, but know that it's not feasible to implement at all times. Finally, I want to point to a couple of guidance documents. The minimum requirements, of course, are one of the key documents. This is the sort of the reopening core guidance document that we hope you will refer to frequently and that we continue to iterate upon based on your questions and feedback. But paired with that is the frequently asked questions on the minimum requirements. And so we will hope that you will look at those two documents as one and the same, as a pair. The frequently asked questions often provide additional flexibility and guidance and help elaborate on some of the things that may come across in the requirements as either confusing or have raised a lot of questions. So please do read those together and consider them as one package. Now we'll move to talking about preparing for reopening.
Thank you, Eli. Now I'm going to talk about preparing for reopening and what this process will look like for you as a group and school age provider. So the reopening process, we really have 3 simple steps for providers to complete. The first step is completing this reopening transaction in LEAD. And this will be released later in the week so that you all can start completing your reopening transaction. The reopening transaction will be in LEAD and it'll be available to you on your home page as well. So you'll be able to go in and see it either in the new transaction or on the home page. One thing to note here is even if you are in the renewal process, you will be able to complete this reopening transaction and it'll be available to you on your home page. If you are an expired provider, we do ask that you start your renewal transaction, but you by no means have to finish that transaction. Once you start the renewal transaction to indicate, yes, I still want to be a provider and I want to renew, then you can start the reopening transaction to begin your reopening. Within this transaction, you'll submit your reopening plan and your staff checklist all in LEAD. And this staff checklist can be found in LEAD within the reopening transaction. So you'll be able to download it there and complete it to verify staff has completed the required training and have all their information up to date. The reopening plan will be based on the template that EEC released on their website on June 12th, and you'll be able to upload this right into the transaction for review. Then the third step is once you complete all of those pieces, you will be receiving the attestation form by email. And in this attestation form, you will agree that your program will adhere to the minimum requirements. This attestation form must be completed by the licensee. So especially for group and school age programs, the program director or anyone that is designated can complete that reopening transaction, but we do need the licensee to complete that attestation form. So if you fill out the reopening transaction and you aren't the licensee, you can go ahead and forward that attestation form to the licensee and they'll be able to go and complete it. Once that's all done, everything is out of your hands and good to go on that part. And it'll turn over to the EEC licensing team. They will review your reopening transaction, really making sure just that all the information's there, you've completed the staff checklist, you've entered your information required that we'll cover in a few minutes. You've uploaded your reopening plan and open it to verify you put in some content there. And if that's all good to go, your program will receive provisional approval and be able to reopen. At that point, you will be able to start providing childcare. During that next period, your EEC licensor will review the reopening plan and reach out within 60 days of provisional approval. At this point, they'll really be going through the reopening plan in more detail, making sure you've answered all of those questions, reaching out to help you update the plan as needed, and helping you think through any areas where strategies might need improvement. Once your reopening plan is approved, your program will receive a final approval email and you'll be all set and good to go at that point and have successfully completed the reopening process. And with that, I'm going to turn it over to Lynn to walk us through what the reopening transaction will look like in LEAD and go through all of the steps there so you're prepared and familiar to do so.
Okay, so I'm going to review how you can submit your transaction so that you can reopen your large or small group childcare program. When you log into your portal, on the home screen, you're going to see a banner like this one that will tell you that we are allowing people now to start the reopening process. And at the end of this statement, there will be a link here that will bring you to the new reopen application, which is what you'll need to fill out and submit in order to start the reopening process. Also, you can go to the new transaction link, which is on the left-hand side of the page, and click that. And that will also take you to the list of transactions that are available to you. And you will be able to find the GSA reopen application, which is the application that you'll need to fill out to reopen your program after the COVID-19 closure. So if we click that, we can start our transaction. As with all of our transactions, the first thing that you'll see is your instructions page. The instructions will tell you what you need in order to completely submit the transaction. You'll need to have your reopening plans ready to submit, a staff records checklist, a classroom group information form. This is a new form for you, so we'll go over that in a couple of minutes. And then the attestation form. The first three forms will need to be sent as attachments to this transaction in order for you to be able to submit the transaction. This is something new for group and school age programs. You will not be submitting these documents through your document library. They'll be attached to the transaction instead. The attestation form, we will email you a link once you submit this transaction for you to click on the link, fill out the form, and submit it back to EEC. We go to the next page. The first thing that you're going to see is information about your program. And then right below that, we ask you for information about when you would like to reopen. So you can supply the date that you want to reopen your program. And then we ask you if you are currently operating as an emergency exempt childcare program or an EECCP. If you have not been operating as an EECCP, you can just choose no and skip the next two questions. But if you have been operating as an EECCP and are still operating, please click yes. And then in the next question, we'll need you to supply your EECCP program number. When you've been answering your attendance calls in the last few days, EEC staff has been trying to supply this number to the person that they speak with so that you would have it when you fill out this transaction. If you have not gotten this number from EEC, please just give your licensor or the front desk a call and they will be happy to supply your EECCP program number because you will need to supply it on this transaction. Next, you'll just need to let us know when you plan to close that EECCP program. Below that, you can update your contact information and the languages that are spoken at your program. And then click Save and Next to move on to the next page. On the next page, we talk about capacities and groupings. The current total capacity that is listed on this page is your current total capacity that's shown on your license, and that's really just there for your reference. During this reopen process, we're not collecting information on this screen about the number of children that you think that you will be able to care for, but rather we're collecting information in a different way here. The first thing we're asking is how many classrooms you plan to reopen with, then the number of educators that you will have, the number of groupings of children that you'll have when you reopen, which may be different than the number of classrooms, the amount of square footage that you'll be using, And then there's a question about whether you'll be requesting the approval of any previously unlicensed space. So this is space that you would not have been approved for under the license that you were using before the COVID closure. So if you'll just be operating under that previously approved license space, you would click no here. But if you do need to have some additional space approved, choose yes, and then you would need to provide some additional details to your licensor. And then click Save and Next. On this page, you can provide the schedule that your program operates. This information will show up on the child care search pages on our website when people look for licensed childcare. So if you'd like this to display, you can just add the information here as to your operating hours. And you can add as many days as you would like. I'm just going to do a couple right now. So this is the attachments page that you have not had to use before as a group and school age program. There are 3 attachments that you'll need to upload to the transaction in order to submit it. You have to upload all 3 in order to have LEAD allow you to submit the transaction. So we're looking for your reopening plan, your staff checklist, and this classroom group information form. So the reopening plan templates have been sent out to you already. So if you've got your reopening plan filled out, to upload that, you just click the paperclip here. You click Upload Files, find your reopening plan on your computer, click it. You can see the file name that you wanted to upload, so you know it's been attached here, and then you need to click the blue upload button, and you can see that it's uploading. When you come back to the screen, the status changed from unsubmitted to submitted, and that's how you know for sure that your document was uploaded here. For the staff checklist, if you look up at the top of the page, there's a link here where you can download a blank staff checklist. So if you click that, the file gets downloaded to your computer. If you click the file, you can open this, you can edit this, fill it out for all of your staff, and save it to your computer. Once you've saved it to your computer, just come back to this screen, click the paperclip again, click Upload Files, find the staff checklist on your computer, and click the blue upload button to attach it to the transaction. The classroom group information form, that will work the same way. You come up to the top and click it here so that the blank form downloads to your computer. Click on that file so that it opens. And what we're looking for here is information about each classroom and the groups of children that are going to be in the classroom, the age group, the number of children, number of teachers, and the number of assistants. And you can fill out as many classrooms and groups as you plan to operate in your program. So then save that file, come back to the attachments page and upload your form again so that it can be sent to your licensor. Once you have all 3 of your attachments in submitted status, you can go to the next page. And you're just about done here. This is your review and submissions, your summary and submissions page, where you can review the information that you entered as part of your transaction. Give it a look, make sure all of your information is correct. If you need to go back and change anything, you can use the links on the right here to go back to the page that you need to fix. Once everything is all set, just click the terms and conditions and click the I agree submit button. You'll get a message that says that your transaction has been successfully submitted. As soon as that happens, you're going to be getting 2 emails from EEC. So if I go to my email, the first email that I get tells me that my license transaction has been successfully submitted. So if I open that email, I can see my transaction number, and this is just informational that says, hey, we got your transaction, thank you. There's no tax certification that goes with this, no fee, so there's really no other information in this email that you need other than to know that we got your transaction. The second email that you're going to get is the email that contains the link so that the licensee of your program can complete the attestation form. If I open that, this is what that email looks like. There's some information in here that explains the attestation form and why we need it filled out. If the person that's going to get this email is the person that filled out and submitted the transaction, if that person is not the licensee, please forward this email to the licensee of the program because they are the one that has to fill out this attestation form. So just forward the email to them. They will be able to open the email and click this link to fill out the attestation form. So when the right person has the email, they just click that link, and this is what the attestation form looks like. It has the name of the program and the program number and the address up at the top, so that if there's a licensee that has multiple programs, this will help them know which form they're filling out for which program. And then the form has multiple statements in it, and each statement has to be attested to. So in order to attest to each statement, you click on the button next to the statement and it will turn blue to show that you attest or agree with each statement. You have to attest to each single one in order to be able to submit this document back to EEC. So I'm going to go through and make sure I attest to each statement. Down at the bottom, you can see a button that says submit signature, but it's not lit up yet. So I can't submit this because I haven't attested to the last statement yet, and I also haven't signed it yet. In order to sign this, it's not like DocuSign. It doesn't actually show a signature facsimile. You just need to type your name in, and that will serve as your signature. Once I do that, I just click the submit signature button, which is now turned bright blue. And that tells me that I can submit my form. This gets submitted to EEC automatically. You don't need to upload anything, and it's sent to your licensor right away. Once your licensor has gotten your transaction and your attestation form, they will look to make sure that all of your other documents have been received. And everything looks good, but they'll be giving it kind of a first pass look. If everything looks good, they will be then sending you a provisional letter that will allow you to reopen your program. This is sent through email, so watch your email for this letter. The subject will say provisional approval letter. When you open it, it will also say that it's a provisional approval letter inside. It will tell you that you are provisionally approved to reopen as of the date indicated at the top of the letter, which is the date that you told us in your transaction that you wanted to reopen. There's more information down through the letter that tells you that within the next 60 days, your licensor will be going through your plans in detail to make sure that they're okay. We also talk about when your EECCP is due to close and that sort of thing. So there is some good information in that letter. Once your licensor has gone through and approved all of your plans and everything else is in good order, EEC will issue you a final approval letter. That also comes in the email. So that's what this will look like in your inbox. And as you can see, it tells you that you now have final approval to reopen, and your reopen transaction is now complete. So thank you. And Margaret, I will pass this back to you.
Thank you, Lynn, for walking us through that reopening transaction. Now we'd like to talk a little bit more in detail about the reopening plans. EEC, as you know, has developed the reopening plan template specific to your group and school age program to provide you with an easy-to-use format to fill out and prepare your plans for reopening. You are encouraged to adjust or adapt this template for your specific use. We especially know a lot of you have already started thinking through your plans for reopening, and you might even have a plan developed already, especially if you are serving as an exempt emergency childcare provider. You might have content from that as well that you want to use. And we don't want to make you recreate the wheel, so we do encourage you to adjust that content, adapt it, and fit it into the reopening plan template as makes sense for your program. We are requiring that programs develop the following sub-plans just to show they've thought through and kind of prepared for anything that can happen. The first is the program operations plan. Within this plan, we're really asking and hoping to see how will you prepare your program to maintain a safe environment upon reopening. And this really goes back to the principles that Eli was talking about earlier, minimizing contact between groups and minimizing any prolonged contact within your group. Second, we have the cleaning plan. So looking to understand how your program will conduct daily cleaning, what's your schedule, and how will this be conducted. Third is the monitoring and response plan. So looking to see some planning and thought on how your program will respond if a child or staff member may become ill. What's your isolation procedure and how will you notify the child's parent? How will you help them safely exit the program, minimizing any potential exposure to other children or staff within the program? Fourth is the medication administration plan. And here we're really just looking to understand how your program will safely administer medication, understanding the challenges and concerns of COVID-19. So looking to see here extra precautions that your program might take when administering medication, especially, for example, in some situations, administering medication might require us to break these guidelines of maintaining 6 feet of distance. So if that's the case, kind of iron out in your plan there how staff might wear masks and wear gloves during the administration of medication so they can ensure both their safety and the safety of the child. Last is the transportation plan, if applicable. And within the transportation plan, we're hoping to see kind of all of the elements of the other plans in practice as well during transportation. So we really ask questions here to understand how your program will maintain the safe distancing within transportation, clean during transportation, make sure all vehicles are cleaned as needed, make sure you have a plan for that as well, and make sure all of those practices are adapted in transportation. So the reopening plan template, as I mentioned, was released June 12th to all providers. And there is a template that's specifically tailored to group and school age. So we encourage you all, if you haven't, to go to the website and download that template, and you can edit it and fill it out as is useful to your program. Within this template, the key area to highlight for you all is these blue boxes where we have several questions that we're looking for answers on. Within the template, the other text is kind of largely a guide setting goals, showing some examples as well, asking some other information, but the blue boxes is really kind of the critical area that we're looking for. And in these blue boxes, there are several guided questions to ensure programs are thinking through what they need to reopen and demonstrating that you're prepared. And you can go ahead and type directly in the blue boxes. Like we said, this is editable in Word, so we encourage you to do whatever is easiest for your program. Additionally, in the template, there are several sample resources and examples there that you can use as is useful to you. So you can see below, there's a sample cleaning schedule. We do ask that you complete and submit one, but it doesn't have to be this one if you already have a sample cleaning schedule that works for you and you just want to adopt it for this template. There are some other examples throughout, and we encourage you to use them if they're useful, but if not, you are not required if not indicated in the document. Next, I'll talk a little bit about some expectations for these plans. And like we said kind of throughout this session, we really want to focus on the key health and safety principles. And like we said, it's really about minimizing the number of individuals with whom any potentially exposed individual is in contact with by limiting contact between groups. Additionally, we want to minimize the prolonged close contact between individuals as much as possible. With this in mind, we do encourage creativity and flexibility in your plans. We know each situation is unique and encourage you to think about what works for your program. Some programs might have classrooms that open up and don't have a standard exit of other classrooms. Some might have more open concept spaces and have to figure out how they want to use barriers to separate groups. We encourage you to use your skill and your expertise as educators and providers that have been in this field for a long time and take your creativity and apply it to this process. We really encourage you to think about what works for your program environment and feel free to propose it to us and we'll help you think through that as well. Additionally, the templates, parts that are optional, but the questions are not. So we really want to ensure you complete those questions in the blue box. And otherwise, please feel free to adapt the planning template as needed to suit your individual purposes. The blue questions, like I said, will be kind of the basis of EEC review. So that's where kind of we'll recommend focusing the energy. And lastly, we're really here to support you. We do not want to be a barrier to reopening, but rather a resource for you all. We know it's uncharted territory for all of us, and we're really looking forward to working with you, helping you with any questions you have, and being a thought partner through this process. During that 60-day review period, we're not looking to be punitive, and we're not looking to criticize your plans, but really just help as a thought partner with suggestions for improvement and ways to think through strategies that work for you. So I'll quickly go through some guidance for developing the reopening plans. As you develop your reopening plan, there's just a couple things to keep in mind and try to avoid. The first is vague strategies. So if you find yourself mainly just listing the requirements or listing the safety practices that EEC is looking for, you might want to take a little time to think a little deeper about what exactly you'll implement and what practices you'll change to meet these requirements. For example, if you find yourself listing in your plan when you're asked the question how you'll minimize contact between groups or between individual children, if you find yourself saying, I'll tell kids to stay 6 feet apart, maybe that's a sign to think through some more creative strategies and put a little more specifics. For example, you could say in your plan, I'm going to use hula hoops to divide the spaces. I'm going to set up activities around the room in individual stations so children are encouraged to play separately, and things like that, whatever works for your program. Another example here is during drop-off and pickup, if you just indicate you'll maintain physical distance during drop-off and pickup, that's great, but we might want to see a little bit more about how that's going to work. So indicating, something like, I will stagger pickup and drop-off to avoid crowds from gathering. I will give parents a time to drop off every day, or I'll have them wait in their cars until next group is ready to come through. We want to see kind of specific examples like that where possible. A few other things just to avoid. I think this should be pretty obvious to you all, but avoid any kind of health and safety violations or things that don't align with the requirements. And a lot of this is things that you all already know and already do in your programs every day, but making sure things are cleaned frequently enough in that cleaning schedule that you're not proposing infrequent cleaning. Making sure that practices are safe and align with those principles. So maybe we don't have parents wait to be screened in a small entryway, but we have them wait in their cars or wait outside in the open air before they're ready to be screened with their children. And lastly, you all know this one very well, I'm sure, but making sure cleaning solutions are stored in an area that is safe, away from children, and kind of indicating that it'll be out of their reach. The last thing we really want to look for before you submit your plan is any missing information. So if any of those questions in the blue box aren't answered, if any of the other things we're looking for aren't included there, just double check yourself, make sure it's good to go. For example, here, just verifying you have the local Board of Health contact information indicated in your plan, and you're not missing anything that might require some back and forth later. And throughout this process, we really want to be here for you, be a support for you. If you have questions, your EEC licensor is there to help. And we really look forward to working with you through this process and helping you with your plans. With that, I'm going to turn it over to Alicia to talk quickly about some changes in the workforce, specifically background record check and educator qualifications. Thank you.
Hello, everyone. My name is Alicia Wells. I am the Associate Commissioner for Audits and Teacher Qualifications here at EEC, and I'm going to go over the group and school age programs workforce changes and modifications. In regards to the background record checks process, as normal, all licensees, BRC program administrators, and employees are required to undergo the full background records check process and needs to be found suitable. Employees include the staff, volunteers, interns, as well as transportation personnel. To support the reopening process, we have modified some requirements as it relates to the BRC for group and school age programs. Anyone undergoing mandatory and discretionary reviews during the reopening phase, EEC will not be requesting the mental health assessments or criminal justice letters from candidates with presumptive records, as allowed by current regulations. This minimizes the documentation needs to be submitted. The full BRC is still required and will be prioritized to ensure expedited review. Individuals who were submitted and approved through the urgent BRC process during the pandemic are required to complete the BRC process. An additional note is those that are needing to do fingerprinting. If any new staff needs fingerprinting, the expired license will be accepted during this time. And so if your license has expired during the pandemic, the Department of Criminal Justice and Information Services will allow for the expired licenses for fingerprinting. EEC has also made some modifications to their educator qualifications and has expanded the process to accommodate educators with higher education degrees and work experience. We're doing this to remove some of the barriers that educators have felt with the teacher qualification process as it relates to course by course reviews, ensuring courses align with categories of study. And so with this, we're allowing for degree-based certifications. For work experience obtained during the pandemic, during program closures, we are accelerating those hours. So the 50 hours of consistent work in one program will be equivalent to 1 month. And so we have modified that regulation to allow for an individual who has worked an additional hours during the pandemic to accelerate to 1 month. As it relates to educational requirements, we are accepting degree-based qualifications towards certification. So those with an associate, bachelor's, or advanced degrees in early childhood education or related fields such as psychology or child development or human services in conjunction with work experience, your the certification process will be accelerated. For example, if you have 3 months of work experience and a degree in one of these related fields or early childhood, you will become teacher certified. In addition, if you have 9 months, you will be lead teacher certified. Anyone who has any other educational backgrounds, your review process remains the same, and that relates to CDAs, Montessori, any individuals with unrelated degrees or no degree at all, you would still have to go through the normal teacher certification process. Again, what we're trying to do is remove the barrier of the course-by-course review and try to accelerate those with degrees in early childhood education and related fields. The reopening guidance has a breakdown of these different levels all the way up to director, so refer to the reopening guidance for additional information. And another barrier that we have removed is the child development course requirement. According to our regulations, an individual needs this minimum course, a 3-credit college course, in order to become teacher certified in our GSA programs. However, we are going to allow 3 CEUs obtained by an IACET training program. And also we will allow child development courses or human development courses through Lifespan. This will hopefully allow for individuals who have these courses on their transcripts to be teacher certified as long as they've met the work experience qualifications. Any teacher qualifications certification applications that needs to be priority processed can be sent electronically to our email address as noted on the slide here, the eecprofdev@mass.gov. Again, additional guidance is within the reopening guidance. Lastly, we just want to show the group and school age staffing needs and certification levels per age group. This information is detailed in the reopening guidance. However, we wanted to detail what is needed or necessary for your classrooms, at least what age group what certification levels are needed per the age group listed in this chart here. Assistance can be used along with a qualified teacher, and for multi-age groups, programs must assign at least one qualified staff person to meet the youngest age group. Again, this chart details the staffing levels needed and the certification levels needed per age group for GSA programs.
Thanks so much, Alicia. Now we're going to move on to talk about resources and support. We know that this is a very difficult time for folks, for providers, for educators, for the children and families that we're serving. There's a lot of concern about finances, as well as mental and emotional well-being, and just general concerns about the virus and about supporting each other through this difficult time. So if you need support, the next few slides are going to cover financial supports, general supports for educators and programs, general supports for families, and then mental health support. As we think about financial support, modifying reimbursement approaches is one of the things that we're looking to do for July and August of this year to better support programs and families so that they can safely and confidently re-enter childcare settings. In order to receive subsidy payment, programs must both reopen in July to continue receiving payments and reach out to families to confirm that they are intending to return to care. A note is that families may transfer their subsidy placement to a new program if that's their choice. It's also important to note that EEC is committed to providing flexibility during this time. We'll be issuing policies this month with the goal of being both flexible and supportive as programs reopen and as families return to care. Some of the guidance that will be issued is around families if they need to keep children home if they're sick or quarantining, and as well as supporting families in maintaining subsidies through these uncertain times. There's some general supports available to educators and programs as well. I think the bottom line in all of this is to know that you're not alone in this system. We are all opening. EEC intends to be as available and as supportive as possible, and we have some partners involved in that work as well. As you've already heard, the learning management system is one of those supports that's available to you. There is the required health and safety training on the learning management system, but there are also additional trainings that are available to you during this time that you might find helpful. The professional development centers are another resource for you, which during this time will be providing direct but virtual support to programs to support both planning and implementation. There is some information about the PDCs, those professional development centers, in our reopening guidance. And then for family child care programs, we also have family child care systems that are available to help support you and the children and families that you serve. In order to find your nearest family child care system, you can look on EEC's website for a list of family child care systems. And additional supports are going to be added and resources will be added and altered as needs arise. There are also some supports that are available specifically to the families that you're serving. The first is our coordinated family and community engagement grantees. These are locally based programs that provide child development services and resources to families with young children. You can look on EEC's website to find one of these programs near you, and they cover all 351 cities and towns across the Commonwealth. So one will be available right in your community or a nearby community to support the families that you're serving. In addition, in LEAD, there's an online community services profile that can be very helpful to you, as well as the Mass 211 resource, which is a referral to comprehensive services for any of your staff, any of your assistants, your own family, or for the families that you're serving. And then finally, our child care resource and referral agencies are another way that you can access supports for families, both around child care searches and subsidy applications under the new criteria. And again, you can visit EEC's website for child care resource and referral agencies. And finally, we want to touch base around mental health support. During this time, it's a critical component of the reopening program that we'll be offering. We want you to be aware that the Early Childhood Mental Health Consultation Program is available to serve you and your program. It's a service that's available to offer crisis and critical intervention support for children and families and educators. There's also professional development that's available in multiple languages. You can see on this slide that there are some topics that might be of interest to you as you're moving forward, setting up your environment, considering your reopening routines, as well as responding to any behavioral or mental health crises that may arise in your program. There are some additional mental health resources in our reopening guidance. And then finally, there are some further resources that might help as you're considering the reopening of your early education and care program. You can start by reviewing the minimum requirements for health and safety on EEC's website, and the website itself is generally a big resource for you as well as for the educators in your program or your assistant. You can take the health and safety training, which is found in the learning management system. You can look at the Center for Disease Control, the CDC's tools to evolve your COVID-19 childcare strategy, which is available right on the CDC website. And then you can also be aware that coming soon there will be a panel with staff from Boston Children's Hospital on healthcare resources for families and operationalizing the minimum requirements. Thank you very much for your time.